It's visible.
Okay, so World Health Organization conducting the World Hepatitis Day to make the awareness of the global burden of the hepatitis B infection. Okay, and today I'm going to discuss. So this is the overview. I'm going to discuss of causes of hepatitis and modes of transmission and brief discussion of high risk groups. And symptoms, signs and symptoms of the hepatitis, and prevention of the hepatitis, and next treatment of the hepatitis. So the causes of viral hepatitis is hepatitis A and hepatitis B, hepatitis C, hepatitis D, and hepatitis E viruses. Hepatitis A and E viruses is the acute infection. So it will usually it will resolve automatically self-limited condition within 2 to 3 months. And the mode of transmission of the viral hepatitis A and E is the fecal-oral route. It usually spread through the contaminated food and contaminated water. And hepatitis B mode of transmission is sexual transmission and perinatal. During the childbirth, it will transmit, and percutaneous transmission. Example, it is a needle stick injury, all this. And secretions through the saliva and blood products. Nowadays, this blood transmission related hepatitis B infection is reduced because of the pre-transmission related screening is available, and hepatitis C infection spread through the percutaneous and sexual transmission and the perinatal. And the high risk groups for the hepatitis B is the high rates of incidence in the spouses who are acutely infected persons, and next one is homosexuals and healthcare workers who is exposed to the blood products of infected hepatitis B person who are required frequent blood transfusion. Example, hemophilia patient who is receiving the multiple blood transfusion, and family members who are chronically infected with hepatitis B patients, and IV drug abuse. Next, the symptoms and signs of the hepatitis B is the usually this incubation period of the hepatitis B is 8 to 12 weeks, and hepatitis C is 7 weeks of the incubation period. The early symptoms is usually presented with low-grade fever, myalgias, and joint pains, usually fatigue, and later it changes into the mild complicated stage with jaundice and upper abdominal pain, liver enlargement. The late complications is accumulation of fluid in the abdomen and gastrointestinal bleeding. And these late chronic liver disease may change it to cirrhosis of liver and hepatocellular carcinoma. So these are the investigations related to the acute hepatitis B. Usually we screen for the hepatitis B patients with hepatitis B surface antigen. So it is positive in both acute and chronic infected patients. So we will decide whether it is acute infection or positive infection by doing the anti-hepatitis B core antigen, IgM and IgG test. And the rate of infectivity will decided by the hepatitis E antigen and hepatitis B viral load. And prevention of the transmission of hepatitis B and C is screening of the infected persons of family members, and screening of baby born to the infected mother, and screening of spouses of infected persons, and usually health related nursing staff and medical staff regular screening, and person requiring frequent blood transfusions. And the hepatitis B prevention is usually by doing regular vaccination for recently birth babies. We can do regular vaccination at birth immediately after 24 hours, and at first month and 6 months. Usually for adults, it is the 0 and 6, 0 and 1, 6 months. And post exposure prophylaxis, unvaccinated person who is exposed to the hepatitis B patient, and post exposure prophylaxis with combination of hepatitis B immunoglobulins and hepatitis B vaccination schedule. And needle stick injury persons of the hepatitis infected person, immediate intramuscular injection of the hepatitis B immunoglobulins plus hepatitis B vaccination schedule. Usually, this hepatitis B and C is the preventable and treatable conditions, but not curable condition. So, hepatitis B is the 99% spontaneously recover. Usually, only 1% patient is converted into the chronically infected patients. And in hepatitis C also, it is recovery is only 15 to 20%. So, it will definitely required in acute condition only treatment. And treatment needed in severe acute hepatitis B infections and chronic hepatitis B. So advanced stage of the liver damage require the liver transplantation.
Okay, so I think we are at the situation of questions. I would now probably give access for people to unmute themselves, and you can go ahead and ask questions regarding hepatitis. Now, I think before Dr. Malesh, the students start asking questions, what are the key suggestions you would give to prevent hepatitis? So in this people families or students families, or students might have their parents or anyone. So what are the key suggestions you give for the students or who are listening to this session to be taken part to prevent hepatitis at early stages?
Okay. So if the family members are infected with, if the family members, anyone infected with the hepatitis B infection, so whole the family should be screened for the hepatitis B. Okay. And so if the persons are negative test for the hepatitis B, so they will should be vaccinated for the hepatitis B.
Okay, so they should be vaccinated with hepatitis B so that they prevent further complications.
And next one is if the family members, if they are married and if their spouse is hepatitis B infected, that life partner should be screened for the hepatitis B, and if the person is negative for hepatitis B, they should be protected for the
transfer or transmission of the virus. Right. So wife and husband, they might have the transmission of hepatitis. So that's why we need to be screened for the hepatitis for the other this also. Now, what are the possible medication treatment? What we have for the treatment of hepatitis, Dr. Malesh?
So for the hepatitis B, there is multiple available of treatment chances. Okay, and there are the two drugs are actively we are using now. So that is the entecavir tablet and tenofovir tablets.
Okay, can you repeat the name so that our students also can make a note?
Entecavir 0.5 mg, 1 mg available, and tenofovir is 300 mg.
Okay, so we have a complete treatment, or we can just give a kind of relaxation to the patients?
So for hepatitis B is the treatable condition, but it is not a totally curable condition. So it might be viral load is somewhat is there even after treatment also, but hepatitis C is the completely curable condition.
Right, right. So one more question our students are asking.
Yes.
So as we have understood about the symptoms are very difficult to understand, or most of people does not show up some symptoms also in the initial stages. Now, how do you doubt about hepatitis B? How do you get a doubt that this patient might have hepatitis B? So that's a question which students are having.
So in early initial stages, it will be very difficult for the suspecting hepatitis B infection, because so when we will suspect the infection, So if the high risk patients, we are exposing to the high risk patients like a HIV patient and tuberculosis patient, and who is presented with jaundice, who is unexplainable cause. So then we can suspect and
Okay.
we can screen for the hepatitis B.
Okay. Okay. Perfect. So I think you will see all the history and all those things, and then you suspect about hepatitis. Yeah. So one more question: what are the different types of hepatitis? Which one is dangerous among this hepatitis? Which is what are the different types? Is first question, and second question is which is dangerous among this different types of hepatitis?
So there is the 5 types of hepatitis viruses is there: hepatitis A and B, C, D, and E. Among those, hepatitis A and E is the self-limited condition that is the acutely presented. So usually it is transmitted by fecal-oral route, like contaminated food and water. Okay, so it will be resolved spontaneously. Also, it will take usually 2 to 3 weeks time to resolve. Okay, we will give the only symptomatic supportive treatment only for hepatitis A and E. So among them, among total 5 viruses, hepatitis B and C is the mostly these are the dangerous viruses because it will convert it into the permanent damage of the liver, and it will may enlarge to the cancer cells, hepatic cancer cells.
Okay, hepatitis B and C are dangerous out of this all. So I think I got that answer. And next question, very interesting question. So we are speaking about COVID since 2 years. There is no doubt about any disease. We are having a word called as COVID, and even students are said that COVID batch, COVID passed out batch. So now one more question these people are asking is effect of COVID in hepatitis patients. Now, what would be the effects of the COVID in hepatitis patients?
So COVID itself, it won't flare up the hepatitis B, but the treatment will use it for COVID is the immunosuppressant drugs and the steroids is then it will cause
Yes.
immunosuppression, so it will flare up the hepatitis B infection.
Right. So now the answer here is when we are using a drugs which are immunosuppressant, so it might give a problem that the immunity level can decrease, and it can affect more on the viruses coming into our body. So that's what, if I'm not wrong, I am understanding it. Next question, how hepatitis can become fatal when a person has other medical conditions such as cancer. So now the question here is how hepatitis can become fatal when a person has other medical conditions such as cancer.
So even in cancer patients also, if the patient is using chemotherapy drugs and radiotherapy, that is also same causes immunosuppression. So it will flare up the viral load of the hepatitis B and C infections. So
Right. I got it. And we got one more question from the chat box. I'm just taking from the chat box also in the meantime so that students can put hepatitis patients can survive. Yes or no kind of question.
hepatitis B and C patient will survive. So if the proper treatment is going, so those people will survive. Will prevent the complications of the hepatitis B and C for the cirrhosis of liver and hepatocellular carcinoma. So lifespan is usual as of a normal person. So the complications are preventable.
Right. I think that's answer this question. One more question I have. I don't understand this question, but I'm just putting it. I'm just reading it out. Does hepatitis transfer through genes?
Sorry?
Does hepatitis transfer through genes?
No. The hepatitis does not transfer to the genes, because if the father is having hepatitis B, it won't transmit to the genetic pattern, but it will transmit to the through the seminal fluid. Mother will infect, no? So through the mother blood, baby will affect.
Right. So I think the answer is no. And the third question, oh, very good. I'm getting a lot of questions. One more question. Will consuming liquor causes hepatitis? So question is, will consuming beer or alcohol or whiskey or brandy causes hepatitis? So people will stop alcoholism if I say yes, or if doctor says yes, people should stop alcoholism. Yeah.
Okay, so alcohol will won't cause hepatitis B and C infections. Okay, but if the chronic alcoholic patient, it will cause liver damage, na? So it will add on for hepatitis B and C infections for more prone for damage.
So alcohol gives more problems to liver, but it does not causes hepatitis. But in turn, it might affect, if you are affected with hepatitis, it might affect your survival or other things. So this is what I'm getting more questions, Dr. Malesh. One more question is, virus related liver carcinogenic cancer related death worldwide. So which tests are required? We will have to do. So I'm not sure if the question is related to the virus related liver cancer. So I'm not sure, Dr. Malesh, do you want to try to answer this? And you have the questions also in the chat box. You can also look at this. The questions are being asked in chat box. If you want to see and answer this. In the meantime, I'll go with next question. What are the signs and symptoms of chronic hepatitis?
So yeah, chronic hepatitis B patient usually presented with a jaundice and dark coloration of urine, and upper abdominal pain and loss of hepatitis, loss of appetite and loss of weight. Okay, and further more advanced symptoms is accumulation of fluid in the abdomen. Okay, and gastrointestinal bleeding.
Right. So I think it answered your question, signs and symptoms. The next question is tricky question. What is the age group and gender group that is affected more in hepatitis? Do you find any specific age group or gender group that more hepatitis are being, you are seeing more hepatitis patients in this particular group? So this is one more question.
A particular age group is around 30 to 50 years age group is more prone for hepatitis B and C infection, because these peoples are active in the present generation. And if the persons are having a high risk sexual behavior and working in hospitals and medical staff, they are more prone for hepatitis B infection.
Okay, so I think and gender group, any specific gender group have you seen that more prone is male or female or any transgenders or something like that?
No, sir. Especially till now, I have seen more are male patients, because especially these auto drivers and cab drivers who are long driving, who are taking long driving. These are more prone for hepatitis and hepatitis C infection and HIV infections also.
Yeah, I think one of the most important thing which Dr. Malesh have said is we need to have a very clean and neat life, which educated people should have. And the awareness is we should not have, what do you say, connects with the different kind of unknown people to avoid any kind of hepatitis. So the prone for hepatitis cause is when you get connected with unknown people or you don't know their history or something like that. So this is a more problematic zone. And now next question, what is a gold standard diagnostic procedures? So test, what is a gold standard test which is available for diagnosis of hepatitis? This is a question which has been asked by one of the students.
So that gold standard test is the hepatitis B viral load test.
Viral load test, hepatitis B viral load test, which will give exactly that whether the patient is suffering from hepatitis. And what is the best available treatment for hepatitis? I think this question already been answered, but if you want to repeat this answer, you can go ahead, Dr. Malesh. What is the best available treatment for hepatitis?
Available treatment options is tablet entecavir 0.5 mg and 1 mg tablets are available, and tenofovir 300 mg tablets are available.
Right. So next one, what are the best practices not to get hepatitis infection? So I think we already have discussed some best practices, but in other terms also, if you want to tell. how those people can campaign about hepatitis, because we need to talk more about hepatitis so that we can prevent this hepatitis in our homes or in our relatives or in our neighborhoods. So any practices, best practices do you give, Dr. Malesh, so that our students put in this words in mind to prevent hepatitis going forward?
First of all, this avoiding the high risk sexual behavior.
Yes.
Next, sharing the common things like razor and this blades for other people, and using barrier methods for the sex like condoms.
Right. Right. And not sharing the razors or not sharing the injections or all those things, and making sure that we are hygienic also. So I think these are the best practices for hepatitis. Yeah. So one more question we have got, very tricky question. Can vaccinated people spread hepatitis? So, so if we start saying if COVID vaccinated people get COVID or not, it's the biggest question. Yeah.
So vaccinated itself it protective for that person, so they won't spread the hepatitis B infection.
Okay, so they don't spread the hepatitis infections because they're already vaccinated with the hepatitis vaccine. So now any more questions anyone have? I'll give 1 more minute of time. So I think we learned so much of good things about hepatitis, how it can be eliminated, how it can be identified, what is a gold standard diagnosis, and what is the reasons for the transmission, and what are the methods of prevention, what is the treatments available, what is the importance of vaccine about the hepatitis. I think we have spoken so much of hepatitis, and everyone will speak now about hepatitis A to E viruses, and which are more dangerous is B and C, and the possible methods is hygienic is one of the good thing. I think any more questions anyone have wherein we can get the answers? Anyone have any more questions? Okay, and I think you can unmute and ask questions also, because I have made unmuting option also ready. So I think Dr. Malesh, this is what the questions our students have, people have. So it was wonderful session. Nearly 70 plus people have attended the session. I would like to thank Dr. Malesh and the Wellness Hospital who have accepted to take a session. And I would like to thank all the students of Clinosol and all the members for joining us for today's wonderful event. And I think why July 28th we are celebrating Hepatitis Day. I think we have already spoken. So this is a birthday for a person who has identified or who discovered about hepatitis C virus and vaccine, and also the diagnostic tool for hepatitis. Yeah, and we are getting more questions, Dr. Malesh. So I hope you will not fire.
So there is no advanced vaccinations are available. So only 2 vaccinations are available that we are using now. Okay.
Do you think that any research is going on hepatitis, Dr. Malesh? Are you finding any research work or the activities which are going on hepatitis currently?
It's no.
Okay, perfect. So I think July 28th is celebrated on the birthday of Nobel Prize winner, Dr. Baruch Blumberg, who discovered hepatitis B virus and all the diagnostic tool as well as the vaccine for the hepatitis, and World Health Organization in this. So can we end session, sir, in emergency case? Yes. Perfect, sir. We are ending the session. Thank you. Have a nice, wonderful evening, sir. Thank you. Bye-bye.